Fine, doctor. For hysteroscopy, doctor, over the years there is a lot of hysteroscope has been evolved from 10 mm, 9 mm, 8 mm, 4 mm, 2.9 mm now. We settle on the 2.9 mm. This is of choice, a gold standard now for the hysteroscopy and cystoscopy. Okay, very fine scope. The 30 degree 2.9 mm is used really well. For laparoscopy, 10 mm 30 degree is used. That's a gold standard. Very comfortable for the gynecologist to do surgery. There are many scopes, 45 degree, 60 degree, 90 degree, 0 degree. Okay, so I will tell you, this is a diagnostic sheet for the diagnostic hysteroscopy or cystoscopy. This is a 2.9 mm, very delicate, doctor. It's called the eye lenses, eyepiece, light post. Okay, these are the three parts. So this is a diagnostic sheet. In diagnostic sheet, doctor, these two lines should be in single line. Always. Some hysteroscope provided with the dots. Okay, dots. So they should be in single line first. Then gentle manner, we should put the hysteroscope here and lock it. Understood? After locking, doctor, it's the duty of the hysteroscopist or gynecologist. Just engage here. Then light post. Then water channel, very much important. Okay. Hystomat is must for the hysteroscopy. And what are the settings for the hystomat, doctor? Maximum pressure on the hystomat should be 120 millimeters of mercury, and flow should be 300 ml per minute. For that purpose, we connected 3 liters of normal saline. 6 liters is our target. Not more than 6 liters we should expend. We should irrigate for the hysteroscopy. That is our limit. Because the second limit is, doctor, 30 minutes. For operative hysteroscopy, we should not cross the 30 minutes. Because anesthesia point of view, intensivist point of view, retrodissection and hysteroscopy, these are the riskier procedures. So we should be very careful. Because during operative hysteroscopy, we are opening the venous sinuses directly. That's why there is sudden gush of flow from intrauterine circulation to systemic circulation, and that is avoided. When the hospital is corporate one, we got MIC backup, that is okay. There is a team of doctors. In a small nursing home like Saidam Hospital, like your hospital, we should be very careful about that. That's why we set a limit. 30 minutes we should not spend for the hysteroscopy. Second is, doctor, please go for the under correction always. Not to go for the enthusiastic correction or zealous correction, full correction. That is a common mistake done by the. In that perspective, people spend many minutes, many hours for the hysteroscopy and light up with the complication. These are the things. That's why we should be very careful. Then this is created. Then white balancing should be done for the white color. Okay, light source should be on for the white balancing. 2.9 mm distance. I am going for the white balancing. See, doctor. Done. I am pressing the white balancing button. At the time of pressing the white balancing button, whole area should be covered in white color. See that notch, doctor. Notch corresponds to the this one, light source. Position of light source. Generally, the 30 degree, doctor. Light source is above, rays are the 6 o'clock, opposite to the light source. That is position for the hysteroscope. Another catchy point, doctor, when you place the eyepiece or the lenses at the external rod, catch the entrelip of cervix with the tenaculum or the Alice forceps, and assistant will introduce the civil speculum. And he will place the eye lenses at the external rod. Just place it and start the water irrigation. Wait for the 6 to 7, 8, 9 seconds. People rush there and they damage the cervix, they damage the endometrium, they create a false passage, they create a perforation. Very common mistake by the hysteroscopy. Just patience is very much needed there. Just place, start the irrigation, wait and watch. The jet of water will create a path. Jet of water will dilate the cervical canal. Okay, and then when you confirm that we are in cervical canal, then this is 30 degree, doctor. We should be 30 degree down in anteverted uterus. 30 degree up in retroverted uterus. Mid post position parallel. That is also important. If you are going for the only hysteroscopy, do the PV examination. That's why. Very important. Don't rely on the radiologist. Okay. So these are the things. Then we should, when we go down, we see the entrance to the uterine cavity. There is some people call it as a black hole, the half moon shaped structure, the blind cave, whatever. But that entrance is and we should follow the spark will enter in the uterine cavity. After entering in uterine cavity, just go to the fundus and come down and see the uterine mucosa. There are 4 to 5 signs on the uterine mucosa that may indicate the diagnosis, clinicians. Like Dr. O's husband, like that, expert radiologists are very few available in the country. Okay, so we should not rely. We should please rely on the clinical findings. Your conscience, your knowledge, very much important. These are 4 to 5 signs. Dr. Strawberry sign, the white dots on the pink background, that is suggestive of the PCOS. On hysteroscopy also we can diagnose the thing. There is a claw sign. Puckering we see on the endometrium. That is seen in the adenomyosis. When you see the no endometrium, that may be the sign of the tuberculosis. When you see the small adhesion, periosseal adhesions, there is sign of the tuberculosis or the mixed infection. More favorite in India and Uganda, they are being developing country, tuberculosis is very much common. We should not neglect the tuberculosis. Okay, and that is not a life-threatening condition. Not to send this, not to send this patient to the government hospital. Otherwise, what happens? They will consult for the pulmonary tuberculosis and the 6-month treatment are not needed for the tuberculosis. Only 2 months are more than sufficient. After 2 months, doctor, we can plan for whatever intervention we are planning for the patient. This is the reported tuberculosis. As per the recent mandate, only 2 months are more than sufficient, and 6 months very difficult to take for the patient and not needed also. Okay, do it. Band kare chale.